Hi, my name is Dr. Glenna Andrews. I am one of the faculty here at the PsyD program at George Fox. I am also a neuropsychologist. And so I am currently the director of the ANT track, or the Assessment in Neuropsychology track at George Fox. People who are interested in doing evaluations, whether or not it's to assist in their work with individual or couples in therapy, whether or not it is to look at how a person is able to learn, if it's evaluating a person's cognitive functioning after a traumatic brain injury or after a concussion, or whether or not it's working with older adults who might be experiencing memory loss, maybe the onset of dementia. It is really helpful to have the tools of assessment, psychological, personality, and neuropsychological assessment as part of the uh, skills that you've learned as you've gone through your doctoral program. There are many different arenas where this can be used. Psychological assessment is often used in schools with children. It's also used in various kinds of performance readiness, like police readiness. Also, personality is used in police readiness. Neuropsychological assessment is used in hospitals. It's also used post-surgery. It's used pre-surgery sometimes. It is also used in private practice with people who have various kinds of brain anomalies following accidents or as the person has been developing. And so it's neuropsychological assessments are ways that we can interface with neurology, with pain clinics, interface with PCPs, or self-referrals from people who feel like they're struggling in some kind of cognitive capacity. We also use neuropsychology and psychological testing in the courts. This is called forensic psychology. Forensic psychology is a very broad area, and the most important skill that you would learn in the program is the skill to do interviews or intakes, but also to do assessments, particularly personality assessments. I do a lot of assessments in Oregon for the public defenders or other attorneys, and primarily I'm called in not to decide if a person can aid and assist in their own trial or whether or not they're guilty except for insanity. I don't do those because I'm not a certified forensic psychologist. But when a forensic psychologist has found that maybe there's a thinking problem with the person who is incarcerated, then I come in and I do the assessments to see how they think and what are their shortcomings verbally or visually. And I look at all areas of the functioning of the brain. It's quite interesting. In neuropsychology, it's important that you have a foundation in neuroanatomy. Also, it's helpful if you can understand some brain imaging. And so it's an exciting field, and you can work in a variety of places. So if you're interested in any of these things, it might be good to take a look at the curriculum for the ANT track. Basically, you're taking a few more assessment courses, plus you are looking for practicums that have 30 to 100% assessment opportunities. And you then might want to look for internships that are anywhere, again, from 30% to 100% assessment. People usually, when they're interested in personality assessment, don't do 100%, but neuropsychology, you would do 100% neuropsychology if that is your area of interest. You can also combine assessment with a therapy practice, and so it gives you some variability in the services that you can offer if you're considering going into a private practice or joining a community mental health center or a group practice. So if you have questions, feel free to ask the faculty about this. I think it's an exciting track. I have enjoyed it my whole career, and I would be happy to answer questions that you have. Thank you.